Sorry, I
and
forgot to
then
start the recording.
we can obviously compile some of our own and then work through our own complaint system using the state sanitary code to address some of the other issues in the downtown.
So I don't know if you have any questions, Carrie?
No.
So Michael, this is the kind of thing that I would appreciate having like a monthly update report on progress on this, developing a program, maybe working in coordination with the building inspector, and some of the other key people so that, we can have kind of um, an approach taken, maybe not a comprehensive approach, but one that is well thought out. And again, I think that focusing on specific areas makes it easier, and hopefully we'll see progress that way, that people can understand that, we are working on some of these blighted problems or blighted properties in a systematic way.
Yeah, and that's my goal. So like I said, my first ones I really kind of want to work on are the ones that have been condemned and been condemned for a while. Obviously they've been sitting there, they've been placarded, people they're noticeable. So I want to try to start with those. The orders obviously been sitting out there for a while, so they haven't come in compliance in quite a time. So that would be my first ones to start looking at. And then yes, we can most certainly, identify certain areas of the city that need more work and systematically go through those using the state sanitary code, building code, and even some of the fire code if we have to. And then I've always learned that going to court with as many orders as you can definitely makes it look like we're all making an effort to clean up the area.
Great. Okay. I think the only other thing I have on that list under that section is that the city does have a software, web-based or app program where people can complain, make them file complaints with the city, and it goes to either the DPW or I believe the rec department. It's called See-Click Fix. And I'm interested in seeing if we can include housing reports of code violations in that system, and also food violations. If people are eating out, if they get, if they see something that they don't think is right, they could report that either anonymously or not, so that there could be public health follow-up on those things. So that's something we need to discuss with the technology department here at the city to see if that program can be, if that function can be added to the existing program that we have at the city.
Yeah, so I did look into that a little bit. So we can definitely talk with them about that. I know so I have a meeting next Friday with one of the agents from Unicity about what they want for our page and what we're looking to really put on that. So I'd love to talk with you before that if you guys have any input on what you'd like to see up there. Because that's really going to be the meeting where I got to tell them, what do we want on our page? Do we want to be able to look at the food reports? We want to be able to make housing complaints, to get updates because they need to build the system to what we want. So I need the input of you guys to know what you really want to see in there, and then I can go to them and see what we can do. Because I definitely want everything to be cohesive and all on there so people can just go right online, make a complaint, like you said, make it anonymously, or a food complaint, or they want to pull up a recent food inspection. So these are all things that program can do. They just need to know what we want them to do, and then they can work it into the program. So I'll definitely need some input from you guys before I meet with him, so I can really just let him know what we really want to build it into for our page.
Okay, well, I will definitely want to meet with you to discuss that for sure. All right, well, I'm going to move on to the next item, which I have on the agenda as food safety program updates. And again, this I would like to be kind of a summary overview of the food inspection program, not talking about individual inspections or individual restaurants, but more of a programmatic view of, so folks can understand what is the focus of the food safety program in Greenfield? I know from many years ago, probably more than 10 years ago, Greenfield participated in the voluntary National Retail Food Regulatory Program Standards, the FDA program standards. And I don't know, where that effort, what that effort led to eventually, if it was just dropped. But at one point, Greenfield was doing risk-based food inspection scheduling. So the more risky the food operation was, the more frequently it was inspected. And very low risk operations did not have, as frequent inspections. That's a program that is an inspection program that the city once had in place, and I don't know if that's still in place, but that's the kind of thing that I would like. I would like the public to know really how we approach the food inspections in Greenfield, how the frequency. And I understand that if we do have that kind of ability in this Municity software, that we can then start doing some analysis of the inspections, looking for the most frequent types of violations, so that we can develop, a better education effort or a better focus on inspections if we know that this is a persistent problem, multiple repeat inspection violations at particular places, or just trends overall. So that's something that I'd be interested in finding out. You don't have to talk about that. I don't want to put you on the spot.
Yeah.
But
No, I can
the
give
other
a,
thing,
I
the
can
other
give a
thing that
brief.
was associated with that FDA program was funding.
Mhm.
There were a number of grants that were available. When I worked at the FERCog, we had a recurring grant for 5 years that was $70,000. And that really helped develop the food inspection, food safety program, including a lot of training that was available for restaurants and restaurant workers. So that's something that I'm interested in us looking into. Uh, we can talk about it at a future meeting, unless you have something you want to add to the overall discussion about the food safety program.
Yeah, so I'm very familiar with that program. I just did all my recertifications for FDA. We were moving into that kind of labeling of different establishments when I left Vermont. And so to kind of speak to that, the way it's kind of set out is it's more, so the higher risk places would be places that are preparing food, holding food hot, serving food on the spot, more of sit down kind of restaurants. The lower priority places, especially now in Massachusetts, since they don't really require places unless they're holding, milk or eggs, something that need time and temperature control, like say a convenience store that just has prepackaged goods. Those would be more of the low risk restaurants and establishments that would have food permits. So it kind of would put, the lower risk, just serving coffee, eggs, prepackaged meals to maybe 1 year inspections. And then places that are actively serving the public with fresh food or cooking on site, those would be places that we have to at least do twice a year. So you would move those places into the other ones. So it's kind of like a high, low. Some can fall in the middle depending on what they're doing. If it's partially takeout or if they're preparing at a different site and then it's, packaged and then sold. So there are some things that kind of find into the medium risk area. But that's kind of like the layout of how that's approached. We can certainly start looking at that. I think as they go through the inspections and as I get familiar more with the establishments in town, I'll be able to, judge which ones will fall into which categories. And then we can most certainly set up an inspection on how these places are, scheduled for their inspections. We can certainly have the ones that are done twice a year and then smaller places that aren't as bad done once a year. So that's kind of how that program works. I'm not sure if that's how they were running it. I am familiar with the grant program. We could definitely look into that from the FDA to do these kind of inspections. I know that some of my inspectors have already done a lot of these classes, so it probably wouldn't be that hard to get some of them in fully certified to do all that. So we can certainly look into that. It is a more practical use of the department's time when you kind of label out who needs to get inspected, because as I said, some places that don't really have any kind of food risks get inspected twice a year, and we could kind of push them down to once a year and still not have to worry as much about the risk of, to the public, just because on the nature of the food they're serving.
Yeah, and I know schools have to be inspected at least twice a year because that's a high-risk population, young children, and also elderly food programs. That's considered a high-risk population as well. So, that's the kind of decisions that I think that it would be helpful for us to get in, at a future Board of Health meeting, kind of an update on the thinking behind the program, how it's being developed, and if our inspectors are working toward becoming FDA standard inspectors. So going through the standardization process, which that I would assume would be possible to do through the PHE grant, increasing the capacity. But we can talk about that some other time. But I think that that's the kind of update that we would like to have at the Board of Health meetings in the future, is kind of the programmatic approach to things.
Yeah, we could certainly look into that. And like I said, I've been through the program, and I think, the risk-based inspections is where the state and the federal government is headed. And I think, again, that will be a better use of our time instead of doing places twice a year that might never have any real critical violations that are really a public health risk. And then we can really focus on the other places, like you said, schools or places that are actively serving the public on a daily basis.
Great. Do you have any questions?
No, I agree.
All right. Okay. And then I'm going to move on to the next item on the agenda, which I have listed as old business. And that is just reminding the board members that we have our own standards that we have to meet as board members, and that is ICS training, which is Incident Command System training. Those are available online. They're fairly simple. I mean, they do take some time to do, and then I think I heard you say, Carrie, that you have completed the foundations for local public health practice course? Almost?
Almost.
So those are the kind of things that we should keep reviewing at board meetings.
Sure.
To make sure that, not only
I'm accountable, but us.
Yeah, not only the public, the day-to-day staff folks getting trained, but the Board of Health also needs to get training, because this is a pretty complicated arena, shall we say, public health. And then I have a list of additional topics for upcoming meetings. I know we're going to add the aromatic fillers onto that list for a future meeting. But as well, I would, and we talked about this at a previous meeting, we would like to have, for the public and for the board, we would like to have a presentation at a future meeting specifically about the public health excellence program, the grant program. And I know that's something that you've been looking into, Michael. You've had a week, I guess, to look into it. But we'd like to schedule at a future meeting, having kind of a presentation just to explain to, anyone who's interested what that program is, what the benefits are to Greenfield for us to be part of it, what the goals are ultimately in increasing the capacity of delivering public health equitably in the community. And then also when you have a chance to give us kind of an overview of what the future looks like in that program as far as the funding and what that money will be able to do for the citizens of Greenfield, the residents here. So that's something to put on the list. And then we would like on the board to be able to kind of get an update on the staff that are currently doing inspections, just like we have standards that we have to try to meet as volunteers. We want the community to understand that we have trained professional people that are doing inspections for the city. And so we want to be able to go through kind of the list of certifications that the staff has, which ones they're working on, kind of get an overview of that effort, because there are always new regulations being put in place, and there are always training opportunities that that are available. We have the training hub right here in Greenfield for Hampshire and Franklin County that we can that we have access to. And so, I think we want to get an overview on where we stand with now that you're essentially rebuilding the public health infrastructure here in Greenfield. We'd like to get an overview of that effort and how, all of this stuff fits together in the big picture. So that can be at a future meeting. And then I'm also interested in having kind of a review of the air quality monitoring system here in Greenfield. I worked on submitting a grant to DEP, I don't know if it was a year ago or more, where we did get 10 air quality monitors. They're called Purple Air monitors, and they're part of, they were received by Greenfield and some were installed, but currently on the Healthy Air Network map, which you can view online, and there's a link to that in the agenda, there are currently only 3 of those 10 monitors that are reporting online. And so I would like to look into why only 3 of those are currently reporting, and they're monitoring particulate matter pollution, air quality particulate matter, which is typically from burning, like the smoke that came down from Canada would have been picking that up. The smoke that moves up the valley from more urban areas to the south, when we have inversions in the wintertime, wood smoke, car exhaust, diesel buses, all of that would be picked up by those monitors. And I really think if we have those monitors, they should all be functioning. So what do we need to do to get those working? And is there grant funding from the PHE grant, the Public Health Excellence Grant? Is there money available to get that network up and running in Greenfield? And this might be something that can be discussed among the other participants in the Valley Health Alliance or collaborative. That might be something that those towns may also be interested in participating in. I think there is a monitor in Deerfield and one in Sunderland, but I don't believe there's any in Leverett, Shutesbury, or whatever the other town is. I'm blanking on it. But that could be something that maybe some of that funding could be used to get those air quality monitors located, calibrated, and on this online mapping system. So that's something that I think we can discuss at a future meeting, but something to think about. And then I think the next item on the agenda is the public health modules in the Municity software that the city currently is using. And that's something that I'm also very interested in doing. For instance, I know that I've been doing some witnessing of Title V inspections and perk tests. And, is that information being entered into the software? Is there a way for folks to be able to view Title V inspections when those reports come in? Can they be publicly available? Is there, this brings in a whole issue of for instance, when people are doing septic systems, are those plans, can those plans be available online? Is the permitting available online? Can we receive payment online? So that people don't have to handle checks and or credit cards or whatever. You know, those are all questions that I would think we should be looking at so that we can eventually go toward an online permitting system that other towns have in place. I know that's something that when I worked at the FERCog that we put in place for all the Title V things. Everything was done online. There was no more paper. Plans were still submitted in paper version because they need to go out in the field, but otherwise, or into a file, but otherwise everything was accessible. It was all web-based. So that's something,
One
if that
second, Glenn.
software can do it.
Just 1 second. Nicole, my inspector is on here. You got your hand raised.
Hi.
Hi, Nicole.
Hi. So we are working on making Unicity go live so that people can do all of everything online. So all of the permitting will be done online. They'll be able to do their payments on there. They'll be able to access everything. They'll be able to look at complaints that have come in for other houses. They'll be able to purchase their permits on there. They'll be able to print out permits if they lost their permit. Everything is going to be at their hand. And yes, when you dropped off your paperwork yesterday, you saw me enter all that stuff in. So yes, everything is being recorded. Everything goes into the system. That is our database. So not only do we do it electronically, everything also goes into our hard copies as well. So we are trying desperately to work with Municity weekly to have meetings to get this rolling, and we are going into the next phase to try and get everything going live.
Well, that's great. I mean, it's great to hear, and that's something that we want to, I think, revisit, get an update on at meetings so that we know what how that effort is going. So,
Yeah, like I said,
so
Glenn, I'll be
Yep.
meeting with him soon. And like I said, we can talk before that if you have anything else you want to add in there. And then after I meet with them, I should have a much better handle on an update for you.
Great. Great. And then the next item I have on the agenda is Board of Health governance development. And that's going to be for a future meeting where we have a discussion about creating a framework for how the Board of Health functions in Greenfield. And I believe there needs to be some kind of a manual specific to Greenfield that is handed to Board of Health members. I mean, I've been here now for 2 months, and I received nothing from the previous board members. I don't know if Carrie was handed anything when she got here, but to me, that it creates some kind of institutional continuance after people leave and new people come on. If they can be handed a kind of a book of protocols, policies, procedures, regulations, and we have talked about reviewing the kind of the Board of Health or the regulation book that exists somewhere. And I think what we need to do is just put this on our agenda for a discussion about really not so much having to do with the staff, but really how the Board of Health itself functions and how we can overcome this kind of lack of institutional knowledge, because this is a very new Board of Health. The members on it are, Carrie's been here for a few months, I've been here for 2. And so, we don't have that knowledge of our predecessors who may have been here for a long time, but they didn't leave us an operations manual. So we're, trying to figure things out, I'd say. But what I would like to do is put in place that governance framework or structure so that it's clear on how things are supposed to be done at the Board of Health level. And that's something that we'll put on for a future meeting, I think, specifically to to address that. And that will be part of reviewing existing regulations. I know we're currently going to be reviewing the tobacco regulations, but I think that all of those things should be periodically reviewed. The fee schedule that that public health operates under, those things, they need to be, regularly revisited. So that's something for another discussion. And then the last thing on the second to last thing on my list for future meetings is that I want to have a better understanding of how the city is complying with reporting and notifying the public and reporting of municipal sewage overflows. I know that was been in the paper recently, that there's a number of places in Greenfield where when it rains more than an inch or two, there are sewage overflows of raw sewage or partially treated sewage mixed with stormwater that goes into receiving streams and brooks and into the Green River perhaps and the Deerfield River. But I'd like to have a better understanding, and I think the public should have a better understanding of that. And there is actually a relatively new law that was passed in the last, 2 years. And there's a set of regulations, 314 CMR 16, that I have linked in the agenda that specifies exactly how that is supposed to be done. I think we need to review that process to make sure that it is in compliance, that the city is in compliance with that public notification and reporting system, and not just that somebody gets a phone call and that's kind of the extent of the notification. I think the regulations require some kind of web-based notification process or an alert that's sent out to the entire community through a reverse 911 type of notification system. But we will want to look at that at a future meeting, maybe in conjunction with someone from the DPW who is in charge of that notification, to have a better understanding of how that system is being implemented here in Greenfield.
So just to speak to that for a second, Glenn. So I am familiar with that. I had to do that back in my old municipal district. The DPW, it seems right now, is following the regulation. They are sending me the emails. The waste treatment plants too that have the issues, or anybody that has the sanitary sewer overflow, also alerts me. So it really goes to the DPW first. They're in charge of doing the alerts. They do a notification on our webpage for the city of Greenfield that pops up in the bottom when you go onto the webpage. So anytime we do have an overflow, it should be popping up on there. They do notify me, which is required by law, and they should be posting in any areas where there's access to the water where the sewer overflow occurred. So I will follow up with them to make sure that they are doing those postings. But right now it does seem like they are following the regulations, but we can most certainly dive into it some more and make sure that we're following everything.
Great. Okay, and then I'll move on to the last thing on the agenda is that I would like to invite someone from the FERCog who is, I'm not sure if they were on leave for a while, but if they're back or if there's someone else, to kind of explain the public health excellence training hub concept and how that program is available for public health here in Greenfield and for the entire shared service arrangement that we participate in. And also, what that means to public health, what the community needs to understand about the fact that there is this funding, there is this training, and that we're working to professionalize the public health staff here in Greenfield. So I'd like to invite them to a future meeting to give us a presentation on that. And do you want to talk about that, Nicole?
Yeah, I would love to. Are you talking about Bree?
Yes.
Okay, so actually, she's been working with our department since our previous director resigned. So she has been training Jess and I since last year. And she has only stopped because she's on maternity leave.
Great.
Okay,
So
thank you.
that's the kind of update that I would like to have at Board of Health meetings, maybe from Michael, but just so that the public hears that, because we hear that you're doing it, but we want to let the public know that we have people that are being trained, that are being certified, and that are professionals, to really instill in the public confidence in the fact that we have a new director here and that we are working to increase our delivery of public health services to the community. So that's the kind of thing that we need to announce to the public and let them know that this is all happening. It's happening behind the scenes, but we want to make sure that they're aware that that this kind of effort is really important and goes unnoticed unless we draw attention to it.
Yeah, just to say, Glenn, I thank Nicole for the update. My staff has been great. They are working very hard every day. I just want the public to know that. Me coming in this job just a week ago, they've been very good. They definitely care about the people in this community, and they care about the inspections and the quality of work they do. So I'm very excited for the future with them, and I know that any training that we can offer, they will take it with open arms, and I think the public will see that in the quality of our work, and that will show.
Yeah. Yes, I think that's exactly it. My interest is in highlighting the great work that the staff does, and really impressing upon the public the fact that we have these people who are doing all of this stuff that it's only noticeable when something goes wrong most of the time. But things are happening all the time that people don't notice because we're maintaining control on food safety. We're doing all of these things so that so that there isn't a public health disaster, and that takes a lot of work, but it's something that people don't see day to day. So we want to be able to tell them that that's all happening. And with that, I have gotten to the end of my agenda, and I have down here that we need to adjourn by 6 because I have a meeting starting right at 6. So if there isn't any other last minute additions, we will entertain a motion to adjourn the meeting. And I'll make that motion,
And I second that motion.
and then we'll do a roll call to adjourn.
Carrie Mimitz.
And Glenn Ayers. So we are officially adjourned. And thank you all for coming.